So I had the pleasure of presenting the Pioneer HF open label extension study today. And I think to put them in context, it's helpful to kind of remember back to what the primary results of the Pioneer HF study was. And that was released last fall and then published in the New England Journal. And the study was a randomized trial of 881 patients, all in the hospital with acute heart failure, and they all had a low ejection fraction of 40% or less. And we enrolled them at some point where they had achieved hemodynamic stabilization. Then we randomized them to either sacubitril valsartan or enalapril and continued that for the next 8 weeks. And in that study, what we learned were really three things. So one, we learned that was well tolerated. There's some concern that when people are in the hospital still getting diuretics, that starting new medicines might be unsafe on their blood pressure, etc. And it was very well tolerated, exactly the same in both arms. The second thing we learned was that there was a dramatic drop in N-terminal proBNP, a really important biomarker in heart failure. And so it seemed like it was having an important physiologic effect. And it dropped quickly in the hospital in the weeks that followed compared with the enalapril arm. And that was the primary result of the study. The other thing we learned, though, is that even in only 881 patients, we saw a really important finding of improved clinical outcomes, mainly reduced heart failure rehospitalizations, which is a really important thing in the heart failure field. So that was the original Pioneer HF trial, and that trial was 8 weeks long. What we did was another 4 weeks where we gave everybody sacubitril valsartan, regardless of what they were randomized to at the beginning. So the reason we did the open label extension study was to try to learn two things, and I think both of them are relevant to clinical practice, especially the second one though. So the first reason we did this was we were trying to understand in those patients who had 8 weeks of the enalapril and then got switched to sacubitril valsartan, what happened to their N-terminal proBNP levels? And what we saw was a very rapid drop. So even over only 4 weeks, there was a 36% decline in their N-terminal proBNP levels. And we know that's really important prognostically for how patients are going to do in heart failure. The second thing we learned is we now have a cohort of 880 patients that have been treated for 12 weeks. Some of them got sacubitril valsartan early in the hospital, and the other ones had enalapril and then delayed sacubitril valsartan. And if you step back and said which strategy was more effective, a very common clinical scenario, should I start this medicine in the hospital or should I just wait until I see him in clinic? It seemed like there was a missed opportunity for the patients that started on the enalapril and then got switched later in the course of their heart failure journey. So there was a 33% reduction in this composite endpoint of death, heart failure rehospitalization, or LVAD implantation. So I think a very clinically and important finding that translates into everyday practice because it's such a common condition.